All right. Good morning. So I had talked a little bit last week about how I had a special guest that I wanted to invite and interview. And this is my dad. This is Dr. Colin Campbell. He's also, yay! He's also a veterinarian, now retired, enjoying the retirement life. But he has a wealth of knowledge from his experience as a veterinarian for the New Jersey Department of Health. And specifically, correct me if I screw up your title, but you were the state public health veterinarian for New Jersey?
Correct? Yes.
Yeah. Okay. And so you worked a lot, obviously, on the public health side. And my understanding is that you were involved when there was like a zoonotic disease that could transmit from an animal to a human and cause a potential public health risk. Is that correct?
Correct. And we would help out local jurisdictions with problems, and we also got involved with things like shelter management and stuff like that. So it's a interesting thing to do.
Gotcha. And so you retired, you've been retired for almost a year and a half now, right?
I think so. I lost track.
Yeah.
Once you leave, you're all gone.
So we'll just put a little disclaimer that you are not the current state public health veterinarian. So they may have changed up some things. We're mostly going to talk about how things were when you were there in your experience. My understanding as well is that this can vary from state to state. So the protocols that you guys have in place might not necessarily be exactly how they handle it in another state.
Correct, but in general, it's handled pretty similar throughout at least through the East Coast where rabies is a big issue.
Gotcha. So today, speaking of rabies, I wanted to talk about the rabies virus, and we got a lot of questions on the rabies vaccine itself with titers, medical exemptions, things like that. We're not actually going to talk about the rabies vaccine today. We're going to talk about the rabies virus from a public health perspective. So I guess could we start with just real simple and how we all know that rabies is a deadly virus, but how does it spread from animals to humans?
Okay, that's a good starting point. The animals that host the rabies virus most commonly are bats and raccoons, and they spread it to other animals. And in some cases, it can spread to people. So that's the biggest, the two most common animals that would be infecting either pets or people.
Gotcha. And then, so would it just be like if I got bitten by a bat or a raccoon, or like if my dog ate a bat, how could either one of those spread? If they were rabid, could that spread rabies?
Yes, but both could. The skin is a barrier, so the virus would have to go through the skin through a bite, most commonly, but it also could you could get infected by the eyes. So if a rabid animal hissed in your face and got saliva into your eye, and you have that stinging feeling, if you've ever had that happen, that would be a very high risk type of exposure. But usually it's through bites. The rabies virus tends to make animals very aggressive and act very strange, and they frequently bite and get very, very aggressive. So typically it's through the bite of a rabid animal that it transmits to a person.
Gotcha. And just generally speaking, I mean, how common was this issue where you either as the public health veterinarian or just the department itself, how many cases did you see where there was someone that was potentially exposed to a rabid animal or their pet was exposed? Like, is it a lot of cases each year? Is it a handful of cases? Kind of, is this a really big issue in the state of New Jersey?
Well, yeah, New Jersey is impacted pretty hard. Last year, there were about over 250 raccoon rabies cases that were identified through laboratory testing in the state laboratory.
Rabid.
Confirmed rabid animals, right.
Okay. And so kind of on that topic, could you talk a little bit? So you said that bats and raccoons are the highest risk. Are there other
Correct.
animals that you guys have seen
Yes,
also
yes.
carry rabies?
Rarely there's a lot of animals can be impacted. We've had coyotes impacted with rabies, goats, sheep, a lot of the domestic animals, all the domestic animals really get impacted. And you can imagine a big cow getting rabies and getting aggressive and that kind of thing. So it's a widely spread, but typically most of the laboratory confirmed cases are either the bat variant or the raccoon variant.
And so you had mentioned a little bit that if they are rabid, they tend to get aggressive, but
Correct.
say if I see a raccoon, are there some typical signs that would point to, okay, they might be rabid versus not?
Right. And we also should add in bats. Bats are a different variant of rabies, but because people are phobic about bats, that it becomes sort of its own little niche to talk about. But see, I'm sorry, I lost what was your question?
Yeah, so the typical, like, what are some of the typical signs that like a raccoon, for example, if it wandered into my yard, what would I would see? Like you said, aggressive, but was there anything else where you would like, oh wow, that might be a rabbit?
It can be a wide variety of signs of it acting abnormal. Frequently, they'll go in circles. They can become what people will call very friendly. They'll like want to come into the house. They'll hang around where people are, which is very strange for raccoons. They're usually very shy, and they can be really aggressive. And it's very scary when you see an aggressive one because you just don't expect it from a raccoon.
Right.
And they'll just be like a monster. They'll be snarling and salivating and twirling around and just going crazy. There's been footage of really crazy stuff like that. But it's a wide variety, and bats are their own subset. And a lot of times people don't have any idea that bats could carry rabies, and they roost in houses, so that makes it a difficult issue.
Yeah. Okay. So what should someone do if they are exposed to a potentially rabid animal, and say they don't know, say they hiss in their face and they don't know if the animal is rabid? What do you do?
Well, if at all possible, try to contain the animal any way you can, so it can be available for testing, and that way you can document whether it's truly rabid or just it's impaired for other reasons, toxins or what have you. But typically, if you are exposure being getting the saliva in your eyes or through the skin, you would want to test the animal. And if you can't test the animal, you have to go through the treatment because of the high risk.
Gotcha. And so my understanding is that with rabies, if there's kind of any question with humans, you just automatically go through the treatment, which is some painful injections, because if you go through the treatment, then you're most likely going to be okay. And if you don't, you risk it, then there's no real treatment after the fact. Is that
right? The treatment isn't really that bad. It's a series of injections. So it's basically like getting a shot like you normally would. Some people react to it. It just depends on the person, but it's really a life-saving. If you're truly infected, a raccoon comes up and bites you, runs away, you can't test it, you would have to go through that to prevent rabies, because the issue with rabies is it's almost always fatal. There's been a few people that have recovered. Most of them are impaired, but in general, it's a fatal disease. So you really have to err on the side of caution. If you're not sure, most physicians will give the treatment right away, and that's what we work on, to try to connect the dots and get people to get the right prevention.
Gotcha. And so I'm guessing, is it the same general protocol? Like if your pet is potentially exposed, if you can safely contain the animal, that would be what you would want to do to get it tested. If not, is there anything similar for animals, like a series of injections,
Yeah.
or just people?
Yeah, usually with animals, they there's a protocol we'll have for a series of injections, and it'll be isolated for that period of time. It's usually let's see, four injections over 2 weeks.
Okay. So there is a similar, even if you're like, so if my dog was exposed, there would be a similar protocol, whether it was me or my dog, that obviously different treatments, but a similar.
Right. And they'd be confined and watched for any kind of neurologic issues. So like, falling over, loss of balance, aggressiveness, things like that.
Gotcha. And so is there a similar protocol, if my dog isn't vaccinated and my dog bites someone, does that fall under like the rabies, I guess the rabies umbrella? Would they still go into a holding period to watch for symptoms, or is that not really as much of a concern when it comes to rabies?
Well, if there's no history of exposure, then usually it wouldn't be an issue. And that's what makes it confusing for the average animal owner. They're kind of they don't really know what to do, and they should have, the best thing to do is to contact their local public health unit in New Jersey. They're municipal, so you've got a group there that can help assess what you should do if that happens. And the difficult thing is a lot of times you don't know an animal is infected. The animal will go out, fight with a raccoon, you don't see wounds or whatever, or it hisses in its face, and it becomes infected and you have no idea. So that's the scary part. It could be in a family home and all of a sudden have these strange reactions and expose a whole lot of people.
Gotcha.
Try to avoid that.
So you had mentioned if you can contain the potentially rabid animal, that the state, I guess in the case of New Jersey, can test them for rabies. How do you test for rabies? Confirm?
Yeah, this is the difficult part. If the animal is a suspect rabid animal, the only way to get an accurate test is to test the brain. That means that the animal would have to be euthanized and the brain sent to the laboratory for testing. And that's really upsetting to a lot of pet owners. It's very hard on them. It seems like a terrible thing to do to your pet. But if the pet is indeed infected, that's how you tell, and it would be life-saving to know that the animal had rabies, and then everybody around it that was, could have been exposed needs to get a series of prophylactic treatments to prevent them from getting the disease.
Right.
So you're not going to maybe know exactly, if it comes back negative, they're kind of upset, we euthanized our animal and that's really sad. But at the same time, if it was positive, it could be life-saving and save lives of other people that handle the dog. Sometimes the dog gets injured and a whole lot of people handle it. Neighbors come over and there's maybe 10, 15 people handling a dog at a big household and such.
And that only happens in the cases of when, the dogs are not treated, right? Or they're not quarantined, treated, and handled properly, or up to date on their vaccine.
If they're up to date on the vaccine is very effective. So if they're kept up to date on their vaccines, it should help. It should prevent them from getting the disease. But there's still a observation period, usually a 10-day observation period.
Just to make sure that there's no
symptoms. And if they don't develop any neurologic symptoms, then they're fine.
Gotcha. It's the same for, So that's how you handle bats. So you said bats was, but you have to test the brain of the bat as well.
Yeah, the problem with bats, if there is a rabid bat in a group of bats, the bat abatement is difficult. It's a whole different specialty of capturing the bats and cleaning it out of the house. And in many cases, people will like sell the house, or it can be difficult if there's a long-standing roost that people don't know about. Sometimes there's places in the attic that nobody goes into, and there can be a lot of bats in there. You really don't know it, you really can't hear it. But if that's the case, we really would recommend trying to clean that out, because if there's a rabid bat in there, it's a big risk to the household.
Yeah, I remember I found like that tiny little baby bat that was so cute that had fallen in my backyard, and I called you and I was like, is there anything I can do? And you're like, don't touch it. It'll be okay. Don't touch it. Don't expose yourself. Right. Be safe.
Yeah, well, it's tough. I mean, that's why it's a really tough disease for people to understand. And the best thing to just hammer in is if you keep your pets well vaccinated, should prevent them if they unfortunately come across a rabid animal.
Yeah, or titers too, because I think some states are accepting titers as well.
I think so, but that it's not. It's going to give you less security than having well vaccinated animals.
Right.
And a lot of places in New Jersey, like they do free vaccinations. A lot of townships will do that, and really, it's a really good thing to take advantage of.
And that's part of the, like, really from the public health perspective of the fact that rabies is something that is a deadly virus, that if a human is to be exposed, they have to even at risk, you have to undergo the treatment, because it is most of the time fatal. So. Right.
And there are human cases. We've dealt with quite a few of them. And it's
in the state of New Jersey, or just nationally.
No, well, both. But New Jersey is a pretty active rabies state.
Really?
And we've usually nationwide there's 3 or so on average human fatalities from rabies.
Wow. Okay. Yeah, I didn't think I would have
known. It's a really terrible death too, unfortunately. It's just an awful. Yeah.
All right. Well, thank you very much for
on that cheery note.
Yeah, on that cheery note.
So thank vaccinate you so much your
for
pets.
all of your information. But yeah, as we said, I said in the beginning, but some people said they jumped in late. We aren't so much talking about the rabies vaccine today because there's a lot of questions around the specific rabies vaccine. We were talking about from a public health perspective, the actual rabies virus, and kind of what to do if you're potentially exposed, your pet is potentially exposed, since it is a most commonly fatal virus. Just best ways to protect yourself and your pets and those around you. I know one time you said that someone found a baby raccoon and took it to the grocery store, and a bunch of people pet it, and it turned out that the baby raccoon had rabies, and there was like dozens of people that were potentially exposed.
When they turn rabid, frequently they have sort of this friendly demeanor.
Yeah.
And so people are drawn to these animals because they seem to be kind of, hi, I'm a friendly little creature, come and play with me. And it's paradoxical. It's a kind of virus that is really clever about infecting other animals.
Yeah.
It does that very well. So that's why we have a big infrastructure to try to help people not get it.
Yeah.
But prevention, the vaccinations are good. And if you see an animal acting crazy, stay away from it, call your local authorities, have them assess it, and say, look, it might have rabies, let's check it out.
And you said there are people that, no matter what state you live in, there's some either local or state program that you could call and you can talk to someone where they can assist you and kind of
Right.
if that is an issue.
Right. Along the East Coast, all the states are really geared up for it. So there'll be some office that can help you.
Awesome. All right. Well, thank you so much. I really appreciate you taking your time. I know you're super busy. Let me.
Not
so
really.
We're gonna. Well, you're busy with packing boxes,
Packing,
not so much
yes.
busy with work. So it's a different kind of busy.